Okay. Hi, everybody. This is my first time ever doing anything like this. So please provide feedback. Let me know what you think. I'm trying to create my story that I can share with a broad audience. So please be kind. Anyway, my name is Carrie Hill, and I suffered a ruptured brain aneurysm in 2009, December 2009. But I had a lot of leading symptoms and issues that were kind of ignored by doctors. So I have four topics that I want to go over as far as, and I'll tell you the whole story, which is really long. So please let me know what pieces you think, provided you with some help and some knowledge, and I can condense those to that. So your feedback is extremely important to me. So I want to talk about how important it is to advocate for yourself. I want to talk about the anxiety that goes with having an aneurysm before and after the surgeries that take place. I want to talk about the actual aneurysm itself, which I like to refer to as bubbles. If I have a moment where I can't find a word or I forget something, I say bubbles. I don't say aneurysm. I don't say defect. I don't say, anything derogatory. I just say bubbles. And I've learned to laugh at that, but it took a long time. And then I want to talk about what kind of things to expect with recovery. All right, so here's my whole story, and please bear with me because it is long. And I'm going to try to interject some jokes here and there, and I may go off topic, bubbles. So please, 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 again, bear with me. And I really appreciate you guys wanting to hear my story and the support that I'm getting from the brain aneurysm site. It's been phenomenal to come into that. Okay, so between April and December of 1999. I suffered four trans ischemic attacks, TIAs. They're kind of like mini strokes. You'll go numb on one side. You won't be able to speak. The numbness kind of comes up your body. It might start in your foot and then come into your leg and then into your side and your arm. And then the last part is your face. And the last thing to go numb is your tongue. And they usually last, for me, they lasted about 30 seconds to a minute and a half. And then I would come out of it and have a nasty headache. I was pregnant during the time that these happened. So they would do head scans, they would check on the baby. And thankfully, everything was fine with my son, who is now 19, going to be 20 this year. Oh my gosh. So everything was fine. Thankfully, they said they were just migraines associated with TIAs, and there wasn't any damage to my brain or any permanent defects. So between my son was born, December 1999, and things kind of settled down after that as far as the TIAs and the headaches. So the doctors told me, don't get pregnant again. It's got to have something to do with being pregnant, so on and so on. So Andrew is my only child. So between January 1999 and March 2009, I probably had four other TIAs, and they were sporadic. And again, head scans, nothing was showing. Sometimes there would be some white matter showing or a lesion, which again is similar to strokes. So I'd stay in the hospital for 2 days and then I'd go home, and that was it. And it would just happen whenever it wanted to happen. I had no rhyme or reason to it. So we're going to fast forward all the way to 2009. And we're going to stay in 2009 and into 2010 and then now. So January through March of 2009, just January, March 2009, I started to have some blinding headaches, the inability to speak properly. Went to the hospital by ambulance from my work once. They didn't do a scan. They just related it with, it's migraines. You're a young, healthy 28-year-old. It's just migraines. Here, let's inject you with a shot and send you on home. So that's what they did. I then went to the hospital again with a friend of mine taking me. And again, here's a shot of migraine medicine, go home. From March to August 2009, I had intermittent headaches, some speech issues, some numbness, some vision problems, just again, sporadic, no real reason why. Went to my primary several times for an injection. And it got to the point where I was like, okay, I need to go see my neurologist because this is not normal. So I went to my neurologist. He said, "Well, you're getting older now, so your migraines are changing. I think you have basilar migraines, and here's a bunch of medicine to take home with you. A lot of opioids." I actually went to the pharmacy to fill those, and the pharmacist told me, if I give you all of this, you're going to die. So I didn't get all of that medication, but I did get some, and I tried to follow, his recommendation to take that medicine. So it was September 2009, and I had taken his medicine one day, and I wasn't feeling right. I was in and out of consciousness. I couldn't hold down water. I was in massive head pain. I had light sensitivity. My neck hurt. My back hurt. My lower back hurt every time I tried to stand up. I called a friend of mine and asked her to take me to the ER, and she did. And this is the third ER that I had been to with similar issues. They again injected me with a ton of migraine medication and sent me home. And when I walked out of the hospital, I couldn't walk straight. I was bent over. I still had a massive headache, but because my pain scale went from, 12 to 4, it was okay to send me home like that. And I mean, I couldn't even see straight, but it was okay to send me home like that. So I went home like that. I had pain every single day on a ranging scale from August, early September through into December. Um, Again, things were intermittent. It would hit and then it would just stop. But I still had, the neck pain, the head pain, but the in and out of consciousness, the not being able to eat or drink, that just kind of faltered out. Some days it was worse than others. Um, let's see. There was one night we were at dinner after my son's baseball game, and he was giving me a hard time about doing his homework. Imagine that, a 9-year-old boy not wanting to do his homework after a baseball game while you're all out celebrating their win. So that was smart of me. Anyway, it was frustrating me to the point that I gritted my teeth. And when I did that, there's something went off in my head, and I don't know what it was. I don't know what happened. And you would think that, oh, that's the rupture. That's when that happened. No, unfortunately, it's not. Um, Apparently, according to my family members, my face changed right away. My eyes were empty. I got up from the table, and my husband at the time took me home, and I had a blinding headache. It was the worst headache I had had almost the entire time I went through this. And called the doctor. Doctor said, "Take your migraine medicine." Imagine that. Take your migraine medicine. Okay. Took the migraine medicine, tried to go to sleep. According to my husband, I was making noises that he had never heard before. I just remember being extremely cold and in a lot of pain. And I could smell gasoline, and I don't know why. There was no gasoline. I was in my bedroom, but those are the things I remember. So the next morning I wake up. I eventually did go to sleep. The next morning I wake up, and again, things are not right, but I got to go to work. I got to provide for my family. I've got to keep pushing on, and I do. And the pain was so bad so many times. I can't tell you how many times I closed my eyes driving on the way home and just said, "God, please do whatever you have to do. I can't take this anymore." Luckily, he didn't take me. It wasn't my time. So finally, I went back to my PCP after I had seen the first neurologist telling me that, "Oh, it's nothing. Don't worry about it," pretty much. And he said, "Okay, well, I want to get you into another neurologist." And I said, "Okay, fine." And between the time he wanted to get me to another neurologist, I was seeing a cardiologist because I was having like massive flushing feelings that were going, radiating through my chest and down my legs and down my arms. And they wanted to check my heart. So I was wearing a 30-day heart monitor. And so I was dealing with that. And now I've got to go see a new neurologist. And the pain every day and having to go to work every day, and life continues, and people have expectations of you regardless whether you're sick or not. And fortunately at that time I had a wonderful job. I loved my job. I loved what I did. It provided a great lifestyle for my family, and I was all in it. I'm a very ambitious person, so when I get into something, I get into it. Anyway, so one day I was driving to work, And the flushing feelings were just so intense that day. And then again, still have the head pain, but the flushing was just face forward on me that day. So I called my boss and I said, I'm going straight to the doctor. I don't know if I'm going to be in today. And I went straight to the cardiologist, and the cardiologist pulled my results and he said, well, your heart looks fine. Have you ever heard of anxiety? Have I ever heard of anxiety? Well, yeah, doc, I have. I mean, shit. Excuse me. I had a baby at 19 years old and didn't know what I was going to do. Yeah, I know what anxiety is, and this is not anxiety. Well, I really think you should go back to your PCP and, get on an anxiety regimen and so on and so forth. But your heart's fine. I was not the kindest person to him after that conversation. And thankfully, I've not had to see him again ever. But that just anxiety. Yeah, I know what anxiety is. But really, so we're going to chalk it up to migraines and anxiety. And I'm sitting here in pain every single day, trying or, thinking, God, please end my life because I can't do this. I can't handle this. And you want to tell me anxiety. Okay. So I left his doctor's office right away and I went straight to my PCP. And yes, I was a hot mess. I had tears. My face was red. I was livid. Because I felt like I was going to have to start all over again. So this cardiologist says everything's fine with your heart. It's just anxiety. So now I got to start all over again and continue to live in this pain and all of the unknowns that go with it. So my PCP said, I'm going to get you into that neurologist, right away. Oh, and by the way, here's some Valium. So take your Valium. So again, anxiety, and here's some medicine to put a Band-Aid on everything you're dealing with, but we're not really going to get to the answer today. And mind you, this is months into massive pain. So I get into the new neurologist, and the first appointment with him, he gave me the regular runaround. Here's a journal. I want you to keep track of your headaches for 3 months, and I don't want you to eat these items. And then I'll see you in 3 months, and we'll see how that goes, and see if we can't figure out what your trigger is. Okay, because it's not like I haven't done that before. So I go home. I'm frustrated. I'm mad. I'm crying. I know in my heart something is wrong, and I know it's pretty big, but I don't know how else to communicate with these doctors that just keep putting me off. So I called the new neurologist 4 days later, and I left a message on his machine at 2:30 in the morning. And I said, I cannot do this anymore. Something is wrong. I don't know who to turn to. I don't know what to do, and I don't know how to do it, but I need help. He called me the next day, and he got me into his office that Thursday. And he said, I think you might have MS. So let's do a scan of your neck. And oh yeah, nobody's looked at your brain. So let's go ahead and do a scan of your brain too. Okay, so I agreed to that. Yay, we're going to get somewhere, right? So I went home and I Googled MS, right? I wanted to know all about MS. And I'm looking at it and I'm going, I can live with that. It's not going to be a great time, but if we can get it under control, I can live with this. This is not a problem. I'm so thankful to have an answer or a possible answer at this point. So it was, I have the exact date. Let's see. It was Saturday after Thanksgiving, 11/28/09. We did an MRI of my neck and of my brain. And Duke and Carolina, I don't know if I'm supposed to tell you where I was. But anyway, Duke and Carolina were playing that day. And my dad was at the game. And I was stuck at Duke doing my scan. So every time they had to change the film that goes over your head, some of you will know what I'm talking about when you go into the machine. They kept letting me look at my phone. And my dad was sending me the scores of the game. Obviously, I'm a Carolina fan. But Duke has my brain. Anyway, so we did that. Did the scan on the 28th. I played phone tag with my neurologist until the 3rd of December. We finally got on the phone together. I had talked to his nurse and she said that she had the results, but she couldn't share them with me. And I was like, oh, okay, well, that means I have MS. So I kept researching and, just waiting to hear it from him that I had MS and what the next steps were going to be. So he gets on the phone with me on December 3rd at about 4:30 in the afternoon. I am sitting at my desk at work. And he says, I think we know what's wrong with, why you're having all these symptoms. And I said, okay, well, is it MS? And he goes, oh, it's not MS. You have a large aneurysm behind your left eye. Okay, great. What do we need to do? I'm still so excited because we have an answer. I have an answer to why I am suffering so much. So he says, I want you to do an MRA without contrast, of course. And we can get a better look at that. I said, okay. He said, scheduling's going to call you. And they did. They called me within about 10 minutes. And at that point, I was being docked for pay, with my wonderful job and my almost perfect attendance. And everything was just barreling downhill with all of the symptoms and the pain that I was having. So anyway, they called and I said, what do you have on the weekends or early morning or evening? And the next scan was like 3 weeks away for that type of scheduling. And I said, no, you know what? What's your next available? They said, tomorrow. Tomorrow at 9 a.m. I said, I will be there. I looked at my boss. I said, I'm going to get a scan of my brain tomorrow again, and I'll let you know if I'm going to come in or not. Okay, no problem. Oh, by the way, they told me I had a brain aneurysm. Oh, wow. Yeah, please go get that scan. I emailed my dad just before I left the office and I said, Dad, they found something. I have an aneurysm. And again, I was super excited that we had an answer at that point. I didn't know anything about aneurysms. I'd never researched them. I didn't understand them. I have an answer. So my dad called me when I was on my way home. It's about a 45-minute drive. And he said, you know where they find aneurysms, Carrie? And I said, no, Dad, where? Apparently in the brain. And he was like, on the autopsy table. Okay, well, I don't care. They found mine before I hit the autopsy table, so I'm gold. I'm good. So I went home and I researched and I researched and I researched. And, I looked at, okay, well, we can clip it, we can coil it, we can, all these different things. So next morning, my husband at the time and I went to do the MRA scan. We did that. I walked over to my doctor's office to get the results right away. And it was a Friday, by the way. And they weren't there yet. So I said, okay, well, we're going to go get some breakfast and then we'll come back. So we did. We came back. They still didn't have the results yet. So I walked my happy butt back over to the hospital near the doctor's office, got my own copy of the scan, walked it back to my doctor's office and handed it to them and said, I'd really like to have these results before end of business today. It's Friday and I really don't want to wait the whole weekend to hear anything. So she said, okay, come back at 1:30 and he'll see you. Okay, I'll come back at 1:30. Mind you, I didn't have an appointment. I was just basically stomping my feet in the waiting room, advocating for myself, maybe one last time. So we come back at 1:30 to the doctor's office, and it was very fast. It was very quick. I didn't even get a chance to sit down in the waiting room. The lady behind the desk stood up as soon as we walked across the threshold and said, he's been waiting for you. We need to get you back there. So they put me in the last room on the left, and my doctor comes in and he goes, well, it's definitely an aneurysm behind your left eye, and it's pretty large. I've got a brain surgeon coming in to talk to you. Okay. All right, I can handle that. It's fine. Now I did shed a few tears because I had done some research and saw what they're all about. And it's kind of like, but it was still an answer. And we could fix it surgically and I could get back to life. And I could get back to being the mom that I used to be and, the friend that I used to be and the daughter that I used to be. So surgeon comes in, not my surgeon, but a surgeon from his practice and stated, yeah, you probably want to do the clip, blah, 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 blah. You're healthy. At that point, I was 29. You're a healthy 29-year-old female, so you can do the clip and you shouldn't have many or any, side effects. Okay. So my surgeon calls me that afternoon and he says, well, we can do this after the holidays. Mind you, it's still December 3rd. We can do this after the holidays. And I said, I really don't want to wait until after the holidays. Again, advocating for myself. I've got this time bomb in my brain and I don't want to wait that long. Well, it's not likely that it's going to rupture or, leak or anything. Mind you, all the symptoms I'm already having represent a leak or a rupture from a brain aneurysm. I'm just saying. So I said, y'all will love this. I said, if we do it before the first of the year, my insurance will cover it 90-10. If we wait until after the first of the year, my insurance will cover it 80-20. What would you like to do? Oh, well, we can probably get you in the next 10 or so days. Imagine that. So my surgery was scheduled for December 15th. Now I checked in on December 14th. They did an angiogram. It's the first time I met my surgeon. They did an angiogram. It showed that it was one aneurysm on top of another aneurysm. And it was about 10 millimeters in size. And it was in the internal carotid artery on the left. So here. He said, it's not a problem. We can still operate on it. I'll see you in the morning. Okay. So I had to stay in the hospital that night. My family was there, talked to all my friends on the phone. I had a very nonchalant attitude going into the surgery. I had confidence it was all going to be done and it was going to be okay. And I was going to go home and I was going to get back to life. And, let me just do this and get it done. And then everything's going to be fine. So I wasn't petrified. I mean, I had some fear and some questions, but I felt like if I showed that to my family, it was going to make it worse because, they're all crying and worried and all that kind of fun stuff. And I just felt like I have to be strong for me and I have to be strong for them. And at no point prior to my surgery did I feel like or have any inclination that I wasn't going to make it. My biggest fear before surgery was I was going to come out and not be able to communicate. That was my big fear. So December 15th, the I don't want to call him an orderly, the hospital employee comes to take me to pre-op. And all he did was flip the lights on at like 6:00 in the morning. Not, hey, it's time for surgery. Just whoop, it's time to go. Again, I was in a different mindset back then. So I just kind of barked at him and said, absolutely not. I need to wash my face and brush my teeth and go to the bathroom and pull my hair back. And then it'll be time to go. And he was like, well, the surgeon's waiting. He was like, yeah, I understand that. And give me 5 minutes. So I was able to do all those things. And I was also able to tuck my netbook, my cell phone, my rosary, my pictures of my son, all under my sheets without them knowing. So, or blankets. So all of that wheeled down to pre-op with me, even though it wasn't supposed to. But again, my big fear was I wasn't going to be able to communicate. I wasn't going to be able to talk. I was going to be trapped. That was what was in my head. That was my fear. And I didn't share that with anybody before surgery. So anyway, they figure out that I've smuggled all this stuff downstairs and they take it away from me, obviously. So the anesthesiologist comes in and says he's going to, use 3 medications to put me out. He's going to be with me the whole time. Woohoo! All right. So it's time for surgery. Started, I believe, at 7:00 in the morning. I was his first case that day. Case, that's what they call us. The surgery lasted 6.5 hours. I didn't wake up until that night at 11:30-ish, somewhere around there, and I was in ICU. And I woke up and I felt the wrap around my head, and I looked and it was sliding glass doors for ICU where I was, so I could see this silhouette, and it was my dad. And I remember saying, "Hi, Daddy," and he said, "Hi, baby." And he came over to the side of the bed and he said, "How are you feeling?" And I said, "It hurts. It hurts a lot." And he said, "They're going to give you something." Again, me, my demanding self. It's not going to work. It's not going to work. Whatever they're going to give me is not going to work. Man, that was really difficult. Anyway, they injected me with Dilaudid. I think that's how you say it. Oh, yeah, it worked. I was right back out into the sleepy land and in no pain. So that next morning I woke up. So now we're on December 16th. I woke up and I had a nurse. His name was Andrew. And nobody was there. My family wasn't there. My friends weren't there. It was 9:00 in the morning, I think, 8:30 maybe. And I didn't take a minute and say, I made it. I didn't take a minute and say, I can talk. I didn't take a minute and thank God. I right away went into, where's my coffee? Where's my cell phone? Where are my glasses? I can't see anything. Why isn't anybody here? Get this catheter out of me. I need to walk. I'm going home. I did the surgery. I did what I was supposed to do. I'm better now. I'm ready to go home. I got a job to get to, a family to get to, a life to live that had been taken away from me for 6 months. That wasn't the best thing for me to do. So anyway, Andrew removed the catheter. That was fun. No, removed the catheter. And I got up and I walked. I walked down the hall. Again, very, very adamant that I was going to go home. So After walking, everything stopped. I was in a lot of pain again. I wasn't talking much. Um, I didn't want to get up and go to the bathroom. I didn't want to walk anymore. Um, so eventually, and forgive me because these are bits and pieces of what I remember and how I remember it. Eventually, they put me in a regular room or a step down room. And I remember seeing some of my friends there visiting me, but I was never all coherent after I took that first walk. They ended up doing a blood patch under CT guide to plug a leak, I guess. I really don't understand, but they did it. And I remember being injected 3 times and it hurt like hell. And I was in a fetal position crying. And they were talking about their Christmas party that they were all going to go to. So the next day, they want to send me home. Physical therapy comes and says I have to walk. Again, mind you, I haven't walked since that first walk. So this is day 3 or 4 post-op, I think. I can tell you. It was, I'm sorry. It was, I'm getting there. December 19th? Yeah, it was December 19th. My apologies. So it's that 4 days post-op. And I haven't walked since 3 days post-op. So physical therapy comes and says, you need to walk. And I tell her, absolutely not. It's not happening. I'm not even getting up to go to the bathroom. I'm not eating. I am laying there like a lump, sleeping 99.9% of the day and complaining of pain. I'm not walking. So she leaves and she comes back about lunchtime. She says, all right, you got to walk for me. I'm not walking. It's not happening. I can't walk. I'm in pain. Hurts. So she comes back that afternoon, a little later. You're going to have to walk for me this time. That's it. You have to walk. So they pull me out of the bed and I walk like Igor down the hallway. She makes me go up a flight of stairs because I have stairs at my house at that time. And I'm holding on to the railing for dear life, walking up the stairs, bent over at the hip because I can't stand straight because my head is just a ball of pain. She marks my sheet that I can go home. She marks my sheet that I can go home because I walked and I made it up and down a flight of stairs. Didn't matter how I did it or how much pain I was in when I did it, but I did it. So they come in and they tell me I can go home, and I'm begging my husband at the time, do not let them send me home. Do not let them send me home. Something is wrong. I'm in a lot of pain. I can't go home. Tell the doctors the same thing. Fat lot of good that did me. So they injected me with something. I don't know what it was. They ripped out my IVs and they put me in a wheelchair. And in the wheelchair, I had a pillow on my arm like this. And I was wheeled out of the hospital like this because, again, I still couldn't put my head straight up because it hurts so bad. So I climbed in the back of the truck and laid down the whole way home. And when we got home, my husband at the time said, all right, come on, let's get out. Let's get you upstairs. I can't get out. I can't walk. Yeah, you can. Yeah, you can. You're fine. You can walk. No, really, I can't sit up. Okay. So he calls my dad. My dad says, well, when she gets cold enough, mind you, it's still December. When she gets cold enough, she'll get out of the truck. She'll come inside. Okay. So Mark picks me up over his, gets me out of the truck, picks me up over his shoulders and carries me upstairs to my bedroom or our bedroom or whatever. Anyway, I immediately lay in the bed. I don't brush my teeth. I don't wash my face. I don't go to the bathroom. I don't change my clothes. I don't take a shower. I immediately lay in the bed and I stayed there for 22 hours and I barely ate. I barely drank those nasty Ensures. That's what he kept feeding me. Later that day, I had a fever of 102. I was in a lot of pain again. He called the neurologist or the neurosurgeon on call, and they told him to give me Tylenol for my headache. How much of that I believe, I don't know, but it's possible. So he did. It seemed to help the fever a little bit, but not by much. So I still wasn't getting any better into the next day, and not talking, not eating, not walking, nothing. So he called again, and they told him I needed a suppository. My head hurt because I was constipated. What I'm constipated with, I have no idea because I haven't eaten in, 6 days, 5 days at this point. But yeah, okay, we'll try that and some more Tylenol. Thanks. So he left to go to the drugstore to get the suppository. We don't really keep those in inventory in the house. I don't know. We're not old enough to need those all the time. I don't know. Anyway, he went to the drugstore and he had called one of our neighbor friends who happened to be a life flight nurse. And she came down to sit with me while he ran to the drugstore. Well, she forced me to get up and walk. Again, I'm walking like Igor. I am complaining the whole time. And he came back. The drugstore was only like 4 minutes up the road. He came back with the suppository. We didn't get that far though. So sorry. So he yelled at me. I was sitting in the chair in the office. That's how far I had made it, which wasn't very far, walking with my friend. And he yelled at me. He said, if you don't want to get better, then don't get better. And there were a lot of swear words in there. And I remember running at him or attempting to run at him and punch him, which is not my personality at all, not even before the bubbles. So he moved out of my way and I went right for my bed and I laid down and I covered myself with the blankets. And my friend pulled the blankets off of me and pulled me up to sit me up. And I started to projectile vomit everywhere. And my eyes kind of went like this. And all of a sudden, we need to take her back to the hospital. I've only been asking to go to the hospital for 22 hours. 22 hours. Anyway, so thankfully, Mark rushes me back to the hospital. And the Duke Life Flight nurse, who was my friend, her husband worked at that hospital as an ER nurse. So he was on shift and they had called ahead that I was coming. So it was literally dragged out of the truck onto a stretcher and right into ER, thankfully. By the time we got to the ER, I didn't know what my name was. I didn't know anything. I really don't remember much. I remember a nurse in a Santa hat, and I remember what looked like hardwood floors. And I remember somebody drawing blood and laughing hysterically on the CT table when they did the CT. That's just what I remember. I wasn't in any, pain or anything. I'm sure I was, but my brain couldn't feel it at that point. They told Mark that I had 45 minutes to live. And that I had blood and fluid and air all on my brain at the clip site. So now we don't have a leaking aneurysm. We don't have a successfully clipped aneurysm. We have a full-on ruptured aneurysm after clip. So I get rushed back into another cradiotomy. I have no idea what they did, but I was in that surgery, according to Mark, for 45 minutes. I was put into ICU. Guess what? I can't communicate. I can hear the questions and I know what they're asking me. And I'm trying to find the answers in my brain and I can't find them. I can't find them. I can't mouth anything. Nothing. Now I can move all my limbs and I can breathe and I can eat. And I'm aware. But I can't communicate. That was my biggest fear. So I think I stayed like that for 2 or 3 days. I really don't remember those details or, family and friends that were there because I don't recall. Sorry. So they, that's not supposed to be this bad. Anyway, they, decided to inject me with a bunch of medication, to see if enough blood went to my brain, if it would work better, because I was in vasospasm at that point. A lot of you know what that is. Some of you don't. So basically my carotid artery, which is one of the main arteries that supplies blood from the heart to the brain, was spasming. So if it's supposed to be open at a 5 so the blood can rush through, mine was more like this. So my brain wasn't getting enough blood and oxygen to it for it to operate properly. So they injected me with a bunch of blood pressure medication. And I remember it worked. I was able to communicate again, not very well, but I was able to say, that I was hot, or that I was hungry, or, different little things. But my organs started to show that they didn't really like that treatment. So we needed to do something else. So they backed off the medications. And when they did that, it started to teeter back down to nothing. Well, not nothing, but inability to communicate again. And they said they wanted to put a medicine ball directly into my artery through same way they do an angiogram. So, entry point at the groin for the artery, and snake that medicine up into the brain and inject it, and it would dissolve. So we did that. It took 22 minutes. 22 minutes. My artery was like this. And then after that medicine, it was more like this. And I could communicate again, and I could talk, and I could recognize everybody. They wheeled me out of that room, what's it called? I don't know. The room where they do the angiograms. And my family was up against the wall. And I remember smiling at them and talking to them, and they were smiling. And it was the first time I had seen them look, I guess, elated and excited and not worried. And they all decided they were going to go to TGI Fridays and celebrate, because they told them it was going to take about an hour to get me hooked up to everything again back in ICU. So they go to dinner. That's the last thing I remember. I don't remember being taken back into my room. I don't remember anything. So the next thing I remember, which according to my family was about an hour and a half, 2 hours later, was an oxygen mask on my face, and not being able to breathe. And my family all around my bed looking so worried. And some of them are crying, and some of them are just beside themselves. And some of them are staying at the foot of the bed to stay out of the way of the nurse, who was running back and forth from machine to machine. I keep trying to take the oxygen mask off my face and tell everybody it's going to be fine and they need to go home. Again, show no fear. Take care of everybody else. So basically, I had gone into pulmonary edema. I had too much fluid in my right lung, so I couldn't breathe. So they brought in a CPAP, and they gave me Lasix, which put me to sleep, and dried up my lungs. So about 3 o'clock in the morning, that morning, I woke up, and I remember asking if my dad was there. My nurse, her name was Helen. She was phenomenal. She said, yeah, he's in the waiting room. She said, let me get you cleaned up first and change your sheets, because you were sweating a lot, and we'll get your daddy back here. So my daddy came back here, and I talked to him for a little bit and tried to figure out the steps of what happened, but my brain was not up to understanding any of that stuff. So I slept again, and the next day was a little better, and then the next day was a little better, and then the next day was a little better. So no more big complications post-op after that. Well, I guess I should say after all that. So I was put into a step-down room, I want to say 3 days post pulmonary edema. I stayed in that step-down room for a day, and then they sent me home. I got to go home. And you know what I did when I got home? I took a shower. The first shower of like 2.5 weeks. Oh, it felt so good. But I couldn't get my hair wet because of all the, stitches. I had stitches instead of staples. First time I got staples. Second time I got stitches. But anyway, it was so much better. And my son, oh, I love my son. It was a pretty day outside, and it was cold. It was December, but it was still a pretty day outside. So he came inside. He didn't know I was coming home that day. He came inside, and he put his pajamas on. He came in my room, and he said, "Mom, can we watch a movie?" Yes, we can definitely watch a movie. And he put on the Transformers. I couldn't follow the TV. I tried. I tried so hard to be into that movie for him. And it just looked like a bunch of different colors that were very vibrant, going back and forth and up and down. And yeah, that was too much. But then it was time for dinner, and I was going to get my dinner in the bed. And my son was like, "Mom, can I eat in bed with you?" Oh, hell yeah, you can. You don't have to leave my sight ever again. So, we hung out, and it was great. It was really great that day. So I had to do cognitive therapy for a year, and I was written back into work on a part-time basis. I went back to work. I went back to work, I want to say 12 weeks post-op. I was out a little longer than anticipated because of the complications. And when I got back to work, I couldn't. I couldn't focus. I couldn't multitask. I couldn't do it. I was tired all the time. People were irritating me, and I used to be like, "Oh, the events coordinator, man, let's have a party for just any given reason, and yeah, everybody can come and woohoo." Yeah, no, I was like, "Don't talk to me. I don't want to know your name," which is very different from my personality. So I pulled out of work, went on short-term disability again into long-term disability, and never went back to work for that company. But I did spend a year focused on cognitive therapy because I had cognitive disabilities, and I still do. Um, it's a new life. It's hard at first to get to understand who you are, and it hurts sometimes that you can remember who you used to be and things you used to be able to do, and the friends you used to have. But you get used to it. You get used to it. You start to laugh about it. But you still have that fear and that anxiety in the back of your head going, "Oh, I got a headache. Do I need to go? Do I need to go to the hospital now? Do I need to call my neurosurgeon? Do I need to? Do I need to? Do I need to?" Having an aneurysm or having bubbles, whether it's ruptured or not ruptured, or little or big, it affects you. It affects your life, and that's okay. That is completely okay. Um, it, your recovery is yours. It is not anybody else's. It is yours, and it is done in your time. Now, resources, yes, you need to reach out. You need to get your resources. You need to, depending on what complications you have or what side effects you have from the surgery, find the resources. Ask your doctor for the resources. Maybe it's a recovery group. Maybe it's a stroke place. Maybe it's just cognitive rehab. It can be a multitude of things, and they have the information and the resources. So don't only advocate for yourself before treatment, advocate for yourself after treatment. It's very, very, very important. They say that the loudest kid or the loudest dog at the vet or at the doctor's office gets seen first so they can get them out of their hair. Be the loudest person you can be for your own advancement, for your own comfort. So I think there's a whole lot more that I can share. I know there is, but I need to put some more notes together and get my thoughts where I need them to be to do that. So I guess we'll call this the first draft. And please, any feedback you can provide me, I would greatly appreciate. And I, wish everyone well. And if you have any questions, feel free to ask them. I'm happy to answer them. And to those of you that are new to the bubble universe, ask all the questions you need to anybody and everybody who's willing to listen. Thanks so much for taking the time to listen. And I really, really, really look forward to your feedback. Take care.